Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Guys, today we are still reviewing the 2024 official ICD-10-CM coding guidelines. Today we're up to part 11B. So if you have not yet viewed 1 through 11A, be sure to go back and view those videos. So let's get started. Hopefully this is making sense and helping you guys in the process. Now, let me share my screen. Again, we're down to chapter 9E on myocardial infarction. So I looked up what exactly is a myocardial infarction. And it says a heart attack is a medical emergency. A heart attack usually occurs when a blood clot blocks blood flow to the heart. Without blood, tissue loses oxygen and dies. Symptoms include tightness or pain in the chest, neck, back, or arms, as well as fatigue, lightheadedness, abnormal heartbeat, and anxiety. Women are more likely to have atypical symptoms than men. I heard women have it in the jawbones and in the upper back. They have pain. Treatment ranges from lifestyle changes and cardiac rehabilitation to medications, stents, and a bypass surgery. So again, an AMI, acute myocardial infarction, is the same thing as a heart attack. All right, so that leads us to type 1, ST elevation myocardial infarction, STEMI, and non-ST elevation myocardial infarction in STEMI guideline. So let's look over at the guidelines. Number 1, sure enough, the ICD-10-CM codes for type 1 acute myocardial infarction identify the site, such as anterior lateral wall or true posterior wall. So now you see why your medical terminology is so important. Subcategories I-21.0 through I-21.2 and codes I-21.3 are used for type 1 ST elevation myocardial infarction, known as STEMI. Code I-21.4 non-ST elevation in STEMI, and myocardial infarction is used for type 1 non-ST elevation myocardial infarction in STEMI and non-transmural MIs. So of course, let me stop right there. I had to go in and say, what is the difference between a STEMI and an NSTEMI? STEMI results from complete and prolonged occlusion of an epicardial coronary artery vessel and is defined based on ECG criteria, where an NSTEMI usually results from severe coronary artery narrowing, transient occlusion, or microimmobilization of thrombus and or atheromatous material. So this explains, and y'all, as I'm coding, when I'm actually working a chart, I am constantly Googling, going through my medical dictionary, trying to make sure I'm understanding exactly what is going on with my patient. It says here, if a type 1 NSTEMI evolves to a STEMI, then assign the STEMI code. And if a type 1 STEMI converts to an NSTEMI due to thrombolytic therapy, it is still coded as STEMI. For encounters occurring while the myocardial infarction is equal to or less than a 4-week period of time, including transfers to another acute setting or post-acute setting, and the myocardial infarction meets the definition of other diagnoses, then codes from category I-21 may continue to be reported. So again, equal to or less than 4 weeks, then the I-20 can continue to be reported. Now for encounters after the 4-week time frame and the patient is still receiving care related to the myocardial infarction, the appropriate aftercare code should be assigned rather than a code from I-21. For old or healed myocardial infarctions not requiring further care, then code the I-25.2 old myocardial infarction. All right, let me make sure I covered everything for 1. Yep. Number 2, acute myocardial infarction unspecified. Code I-21.9, acute myocardial infarction unspecified, is the default for unspecified acute myocardial infarction or unspecified type. Now, if only type 1 STEMI or transmural MI without the site is documented, assign code I-21.3 ST elevation, which is a STEMI, myocardial infarction of unspecified site. So make sure I covered everything from number 2. Yep, just from the guideline. Now, number 3, AMI documented as non-transmural or subendocardial, but site is provided. Says the guidelines are clear on this, okay? If an acute myocardial infarction is documented as non-transmural or subendocardial, but the site is provided, it is still coded as a subendocardial acute myocardial infarction. Okay? Number 4, subsequent acute myocardial infarction. Let's first look at the guidelines. A code from category I-22, subsequent ST elevation, which is a STEMI, and non-ST elevation in STEMI, myocardial infarction, is to be used when a patient who has suffered a type 1 or unspecified acute myocardial infarction has a new acute myocardial infarction within the 4-week time frame of the initial. This is a heart attack on top of another heart attack. A code from category I-22 must be used in conjunction with the code from category I-21. And then the sequencing of the I-22 and the I-21 codes depend on the circumstances of the encounter. But it says here, do not assign code I-22 for subsequent myocardial infarctions other than type 1 or unspecified. For subsequent type 2 acute myocardial infarctions, assign only code I-21A1. For subsequent type 4 or type 5 acute myocardial infarctions, assign only code I-21.A9. And if a subsequent myocardial infarction of one type occurs within 4 weeks of a myocardial infarction of a different type, then assign the appropriate codes from category I-21 to identify each type, but do not assign a code from I-22. Codes from category I-22 should only be assigned if both the initial and subsequent myocardial infarction are type 1 or unspecified. So let me show you. What I love about this is that your books, my number one saying, my students will tell you, Codemaster Coach's number one saying is love your code book and it will love you back with the right answer. So this is a copy of the tabular list. I went to I-22 and look, it tells you I-22, subsequent acute myocardial infarction. Then up here, it tells you a STEMI is an ST elevation myocardial infarction with 100% blockage of a coronary artery. A STEMI is more severe than an NSTEMI, and use a code from this category when a patient who has suffered a type 1 or unspecified acute myocardial infarction has a new acute myocardial infarction within 4 weeks of the initial acute myocardial infarction. So your book, your code book, is telling you how to appropriately assign codes to acute myocardial infarctions, STEMI versus NSTEMI. Okay? Moving right along, number 5, other types of myocardial infarction, straight from the guidelines. The ICD-10-CM provides codes for different types of myocardial infarction. Type 1 myocardial infarctions are assigned to codes I-21.0 through I-21.4. Type 2 myocardial infarctions are assigned to code I-21A1. Myocardial infarction type 2 with the underlying cause coded first. Do not assign code I-24.8 other forms of acute ischemic heart disease for the demand ischemia. If a patient with type 2 acute myocardial infarction is described as NSTEMI or STEMI, only assign code I-21A1, the STEMI. Codes I-2101 through I-21.4 should only be assigned for type 1 acute myocardial infarctions. Acute myocardial infarctions types 3, 4A, 4B, 4C, and 5 are assigned to codes I-21A9, other myocardial infarction type. And it says here the code also and code first notes should be followed related to complications and for coding of post-procedural myocardial infarctions during or following cardiac surgery. Straight from the guidelines, straight to the point. And 6, take that 7 off of there. Myocardial infarction with coronary microvascular dysfunction. It says straight from the guidelines. Coronary microvascular dysfunction, CMD, is a condition that impacts the microvasculature by restricting microvascular flow and increasing microvascular resistance. Code I-21B, myocardial infarction with coronary microvascular dysfunction, is assigned for myocardial infarction with coronary microvascular disease, myocardial infarction with coronary microvascular dysfunction, and myocardial infarction with non-obstructive coronary arteries, which is MINOCA, with microvascular disease. Okay, right, and that leads us to the stopping point, because again, I don't want these videos to get too long, but I want us to stay on point. So again, this completes chapter 9, and next week we'll be in chapter 10, diseases of the respiratory system, starting at codes J00 through J99, which includes the U07.0 code. All right, guys, I hope this is coming together and beginning to make a whole lot more sense as you're studying your official coding guidelines. And don't forget, January, I always start a new medical coding class. So this January, I will be starting a medical coding level 1 class with Codemaster Coach. So if you want additional information on my medical coding program, be sure to email me at codemastercoach, all one word, codemastercoach@gmail.com. Okay, guys, thanks. I'll see you next week.